Hi guys, Carolyn Kemps here, instructor and trainer with Equi-Health Canada. As veterinary care is extremely limited unless in the case of an emergency, we're going to give you a few things that you can look for and things that you can do on the farm and let you know when it is an urgent call to your vet. As we're getting ready, waiting and watching and hoping show season returns to normal soon, first and foremost, the biggest medical issue that many horse owners face, of course, is colic. Colic is always an emergency and it's always a call to your vet. You might not need them right away, but at some point things may deteriorate where you do need intervention or possibly transporting your horse for care. Colic can be any type of a gastrointestinal issue. Could be gas, sand impaction from feed, dehydration, torsion, etc. Call your vet, have a conversation with them, be prepared with vital signs. You should know already, and as we teach in class, what your horse's normal vital signs are, being respiration, pulse, temperature, gut sounds, hydration, etc. Have that conversation with your vet and determine how quickly they need to come on scene. The next one, as we move into the green grass growing, or other things that can cause a horse to go into a condition called founder or laminitis. Infections, illnesses can also cause this metabolic instability that is now affecting the feet. The feet will become very hot, and as you can see, this horse has moved back to get the weight off of his feet as much as possible. This is again a call to your vet. They're going to want to get on scene, get those feet cooled off as quickly as possible, and help to prevent coffin rotation. Another one that may be managed at home, although this is a fairly advanced case, is a condition called rain rot. So it's an infection. It's actually a very contagious infection. As you can see, that's causing hair loss in raised clumpy patches along this horse's back. Home remedy, tried and true. I've had experience with it, and that's actually to use mouthwash 50-50 mixed with water and just sprayed over the area. Now this is something that your vet may also have to take a look at, especially if it's progressed to this stage, but be wary. This is a very contagious condition, so brushes, tack, blankets, etc. should be kept separate for this horse. As well, you're going to want to avoid horse-to-horse contact. So follow your biosecurity measures. And again, have a conversation with your vet when in doubt. Another one that we see popping up quite often in the spring, particularly on horses with white legs, particularly at the back of the legs, is called scratches. Scratches can also progress up onto the belly. I have seen those patches. Now, scratches, again, a different type of infection, but as you can see, these raised scabby portions, they can become quite painful, quite uncomfortable for the horse. In treating this, what you're going to want to do is to keep the area as clean as possible. That means keep them out of the mud as much as possible. Clean the area and dry the area thoroughly, but do not remove the scabs. These are going to be very painful and a very difficult treatment for your horse if you try to do this. Recommendation is to use even something as simple as diaper rash cream. You can use MTG, you can use there's a lot of different oil-based products that you can use to treat the infection, but also to prevent the scabs from making the horse very uncomfortable. And the last one that I wanted to touch base on is anybody that's ever picked up a foot and caught that really horrible odor known as thrush. You can see thrush typically occurring along the sulcus and along either side of the frog. And again, another infection that's going to be very difficult to treat because a lot of times this happens in wet, muddy, or unthrifty conditions. Again, drying the area, you're going to want to use a sulfur-based product. I've had good results with copper sulfate crystals. Thrush Buster is a product that used to be on the market that's now banned because of gentian violet. But Copper Tox, readily available in any tack store, is also very effective. Doesn't smell very good, but neither does thrush. Keeping your horse's feet healthy, keeping their skin healthy, and keeping their bodies healthy while we're waiting for resumption of normal duties. So I hope that we can all see you in clinic. Feel free to reach out to any Equi-Health instructor at any time for any questions that you've got. But when in doubt, give your vet a call. They're more than willing to take your calls. Thank you so much, and we hope to see you on the road soon.